or adverse events often happen in small numbers, so you tend to need to aggregate large numbers. So there is a justification for looking at larger numbers across multiple states, but I think you can do that using de-identified approaches.
Ahead of the deployment of millions of coronavirus vaccines nationwide over the next few months, the CDC has asked states to sign data use agreements that will allow them to track patient information. But is that safe? Dr. Sean Granis advises the CDC on data gathering for immunizations. He says it depends on how the information is protected.
Historically, state public health agencies have reported data in aggregate or de-identified fashion to the CDC. It is less common for state public health entities to send identified data to the CDC.
So are vaccine providers in the DMV going to comply with the CDC's request for patient information? And will they send it as identified or de-identified data? WUSA 9 reached out to the health departments of DC, Maryland, and Virginia to see if and how they'll be sending coronavirus vaccination information to the CDC. Both Maryland and Virginia say they've signed the data use agreement. DC didn't respond to our request for information. So what happens with the data of patients who received the vaccine in Maryland and Virginia?
Most states have what's called an immunization information system to track this information. They're done with very secure systems, but those systems have to be able to see Mary Smith, her date of birth.
The Virginia Department of Health says they'll be sending the CDC de-identified data, but didn't specify which data they'd be sending nor which immunization information system they'll be using. The Maryland Department of Health sent the following statement. As with all vaccinations, it will be managed by Immunet, the state's immunization and vaccination secure database, which is HIPAA compliant. Furthermore, Maryland Department of Health cybersecurity personnel performed an assessment of our systems and they found no issues.